All right, and then the last thing I wanted to go over is HIV, just some terms so we understand. So HIV is the virus. It's a virus that infects the body and it attacks the immune system and kills it off. Okay, HIV is the virus, human immuno, meaning immune system, deficiency, meaning not enough, virus. And it is a virus that eventually causes a syndrome called AIDS, which is acquired immunodeficiency syndrome. That means that the virus has killed off so much of the immune system that your immune system can no longer protect you from, they call them opportunistic infections. That means that infections that you and I would be able to fight off easily because our immune system is made to do that. We are not an AIDS patient has no immune system left to protect themselves from any of the diseases that are out there. So a person can go many months or years without symptoms after infection. Even once that once that virus is in the body, whether you have symptoms or not, you can pass it to any sexual partner that you have. All right, let's see. So transmission modes, there are 4. So there's blood, semen, vaginal secretions, and breast milk. So those are the 4 ways that you could pass HIV to others. Okay, and you are infectious whether you have symptoms of the disease or not. So some things to make clear: HIV is not transmitted by casual contact. So you can't, so if someone has HIV and they hug you, or they're in your class, or you use the same pencil or hold hands or like that, is not how you pass HIV. You cannot get it that way. You're not going to get it from a toilet seat that you share or from a seat you share. They say small amounts of HIV are present in tears and saliva and sweat, but that they're so small that the chance of getting infected from these is very unlikely. Blood transfusions, they test the blood since 1985 when they realized how it was passed. They test it for HIV, so the chances of getting HIV from a blood transfusion is very, 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 very small. So things to do to protect yourself: avoid contact with blood or body fluids. If you are doing first aid for someone, protect yourself. Don't put your hands in someone else's blood or body fluids. Use gloves, use barriers. No personal history of potential sex partners. Have protected sex using a condom. It will lower your risk. It does not eliminate risk of STDs, right? It lowers the risk. Because remember, condoms protect the penis, the shaft of the penis, but you have areas around that skin can touch. If any fluids come in contact with vaginal secretions or semen, you have the potential to spread it. Abstinence is the 100% effective way to prevent any of this. And then sexual fidelity in marriage, meaning don't mess around. If you're married, you're not having an affair, you're not sleeping with anyone else. Avoid drugs or being with anyone that does drugs because they make bad choices when they're using, and it can put you at risk. Get regular checkups and act responsibly, meaning if you have something, you need to notify a potential partner. And some terms just to know: if you think you might have been infected with HIV, you can have a blood test. Okay, you can go to your private physician or you can go to the health department. So an HIV test that you take detects the presence of HIV antibodies, which are produced when HIV is present in the body. If they are detected, more tests are done. And then if a person is infected with HIV, they are said to be HIV positive. If you think that the HIV infection is recent, meaning it just happened, A blood test may not be accurate because it takes 3 months for a detectable level of antibodies to show up in a blood test. So a person should avoid all risky behavior, come back, and be tested again in 3 months. Okay? And here's some statistics, and these are from 2004. They're very old, but we see a high rate of HIV. People don't talk about it as much, and it's still very much out there. People die from AIDS all the time. Keeping a very, very high immune system, taking care of yourself, eating very healthy, exercising, all those can help keep your immune system high to prolong your life. If you are infected, counseling is really important for those infected and family members and all of that.